Welcome, Christian. This is Christian Whitehead from CG Financials. Thanks for joining us on the show today.
Yeah, thanks for having me, Dad. Excited to be here and to have a discussion.
All right. Well, you want to give us a little background about what you do at CG Financials, first of all?
Sure. So I'm a certified financial planner and a chartered financial consultant. So I work for CG Financial in the greater Lansing area. And essentially, we're holistic financial planners. So we do everything from retirement investments, estate planning, tax planning, and then, of course, what we're talking about here tonight and helping for senior care and long-term care planning.
Okay. All right. So can you explain why early and comprehensive planning for senior care is a critical component of financial planning and what challenges families face as they're preparing for long-term care?
Yeah, that's a great question. So I would say you can kind of answer this question in a couple different ways, but let's start with why it's important to do due diligence, right? To be very proactive and get to an early start, as you stated, in terms of planning for senior care, long-term care. I would say number one, just from a cost management perspective, I think as most people know, the cost of anything, let alone healthcare, certainly has gone up over the years. So a lot of times if the planning isn't done proactively, people really don't have their arms around what potentially the costs could be for really any type of care. So that's certainly one of the things I would tell people why it's so important to plan ahead. That can also inherently present a challenge. All right. So again, if resources aren't allocated, aren't aligned properly, that's really one of the big ticket items, if you will, that can potentially, from our perspective, derail a financial plan, is if they haven't fully thought through and done calculations to understand what the potential costs could be. I would also say it's important to start early in terms of planning because there are so many options in terms of types of care and quality of care. And we try to have conversations that really get down to, for that certain individual, what is it in terms of the type of care that they want? How does it align with their values? And so again, making sure you're taking time up front to understand what types of care are there, you'll be much better prepared. Heaven forbid you enter that scenario, but you'll be much more prepared in understanding, and again, having all of the options well understood to make sure that again, you can make the proper choices. And then of course there's always the legal component to this. So a lot of times when we're working with someone, we're going to bring in a subject matter expert, an attorney as an example. And there's certain things with powers of attorney, with certain healthcare directives, that again, the sooner you start to think about that and plan for those, not only will you have those documents in place, but you'll hopefully be able to have conversations with those decision makers, those people that are involved in your plan, the stakeholders, as we like to call them. And again, everybody will be on the same page. And I would say on the other side of that, what challenges above and beyond just the cost component and the information overload, a lot of times is at least the term we hear from clients. One of the big factors that I think people don't often think about is, not only if you're someone who's preparing for if you need care yourself, but also more importantly for someone that's potentially going to be in the position to give care, i.e. a family member, not planning and thinking about and the challenge around potentially the emotional and psychological toll that can take. So that's one of those items to where, it's more than just the dollars and cents. You really have to think about and get your arms around what the emotional and psychological component is, because that can be a pretty big burden, especially for those that are giving care. So it's very, very important. And I would say, again, why it's important to plan, but it also can potentially be a challenge is some of the, the emotional components that are involved with senior care.
Yeah, we see that quite often with, a spouse caring for, their husband or wife, and then all of a sudden, their health starts declining as well, not just, psychologically, but physically as well. It just wears them out. So,
yep, absolutely.
It happens quite often. So, what are some common misconceptions or overlooked aspects about planning for senior care that you think everyone should know about?
Yeah, so another great question, right? And again, you can kind of argue overlooked aspect, the cost component. So, I go to that one because that's often most common, at least the conversations I have with folks, is they just don't really have any context or haven't really looked into what potential costs are. What I would say, another common misconception is that certain government programs, let's just say, Medicare, Medicaid as an example, will cover those costs. They certainly will help and potentially act as a supplement. Excuse me, but they're not going to cover every component of that care or potential care that you may need. So that's often a misconception that I see when talking with folks. I would also say one of the misconceptions, and again, it ties into your earlier question. A lot of times I'll hear people tell me, "Well, I'm too young, right? It's too early for me to start thinking about this and planning for this." Which again, as you know, I'm sure, Deb, in your experience and what we've seen on our side, unfortunately, things do happen. And if you're not prepared, or at least thinking about that worst case scenario as challenging sometimes, and is not as fun as it is to think about those things, especially while you're healthy. Again, oftentimes we'll hear people say, "Well, that won't happen to me, right? Or I'm too young. I don't need to think about this." And often, more times than not, something does happen and they haven't done the proper planning, and now you're scrambling, right? Now you're making decisions, and that causes additional stress that potentially could have been avoided. So I would say that that's a big misconception. And also to assuming that family members will provide care. So again, I think, from my experience in talking to folks about this, that can be a bad assumption, right?
Right.
Not just because I'm not saying, family members don't want to do that, but again, it goes back to some of the emotional toll, right? Some of the physical toll, as you mentioned. Don't assume that your family is, number one, going to want to do that, but number two, can, right? And or are capable of providing care. So that's a big misconception too. And I think, again, from kind of the overlooked components, that ties into people don't often think about what it takes, not only for, if I'm someone who's receiving care, but also if I'm giving care, there's preparation that needs to go into that, right? Both, as I said earlier, emotionally, psychologically, physically. And, again, that's just one of those things that people don't often think about. They're so focused on the dollars and cents, which, I can appreciate that, being a numbers guy. And that's certainly a big part of the planning component, but that is not the only side of this type of planning that you need to look at. So, above and beyond the others, again, I would stress that oftentimes is probably the most overlooked aspect, is they're not really grasping, what the potential emotional and physical and psychological tools are.
Right. And as people progress too, they don't always understand how much more work it's going to be as they continue to decline. So, and it's okay for a little while, but long term, it's not always a good situation.
Yeah. And it's really hard to, of course, predict any of that, right? Much like a lot of what I do, right, in looking at the financial markets, there's so much variability and so much unknown that makes it hard. It makes it challenging for people to really understand the significance of, if an event like this happens to where I need care, or I'm in a position where someone wants me to provide care, or I am actually providing care, the fact that they can't really put themselves in that position without maybe having prior experiences with family members or having done it before, it makes it all much more challenging. And that's where, again, we try to have those conversations just to get people's frame of mind maybe a little bit different than what they've traditionally approached it as, to help them understand, all of these other non-financial components that go into a good senior care plan.
So how do you or your firm approach the integration of senior care planning in the overall financial planning process for your clients?
Yeah, so it's certainly, one component of a good plan, but in general, our approach is, this can be a very complex topic. It can be a very stressful topic, especially if, you're in a position where you're having to make decisions maybe sooner than you anticipated. So our approach is we try to take this complex topic of senior care, long-term care planning, and make it as simple as possible, right? And really what that means is we want to listen to you. So anytime I sit down with someone, anytime one of my colleagues sit down with someone, really take the same approach, and we ask a lot of questions. It's not because we're nosy, but it's really we want to understand from the person sitting across the table, from their perspective, what's important to them about this? What are their values, right? So that in turn, once we ask those questions and we hear what you're saying, we can help provide solutions, right? We'll solve some of the potential issues that are obvious, right? That potentially everybody at the table sees. But then more importantly, I think we'll also look at some of the maybe longer term, not so obvious, potential gaps, if you will, and provide solutions there, right? And that really, to me, allows us to take a more personalized approach. Again, just because it starts with understanding really what's important to you, where your values lie, and then we'll help you formulate a team. So it isn't just me, or it isn't just one of my other colleagues. We're going to help you formulate a team, and that means two things. Number one, it's a professional team. So someone like myself, an estate planning attorney often kind of gets involved. Obviously, you've got a medical team, right, that will get involved. But then I would say you also have a personal team. That could be family members, right? That could be certain people in someone's life that they want involved in these types of decisions and in this type of care. So we do the best we can to help quarterback a lot of that, at least to help facilitate conversation, have family meetings. So that's, I think, something that's very, very important is, as someone continues to plan or is starting to think about these things in terms of care planning in the senior years, is let's get the family together and just start a conversation, right? So I would say that's our approach in general, is just we're going to boil this complex topic down to as simple as we can, make sure that we really truly understand, where your views are, what perspectives you have by asking questions and listening, and then, solving it for you. And ultimately, this is an ongoing conversation, right? This is an ongoing engagement from our perspective. It's ever evolving, right? There is not one thing typically, that you set in place and then that always is going to check all boxes moving forward. So that, we have to have a plan that's ever evolving, and make sure that at the end of the day, we're giving you confidence to where, if you do need to utilize senior care or senior care plan, hopefully we've done our job and provided you with the confidence to go into that situation, knowing that you've done the proper planning.
Okay. So if somebody's just starting out, what would be the first steps that they would take?
Yeah, I think really, Deb, it just starts with having a conversation. And I get that's easier said than done a lot of times, just because everybody's got family dynamics, and it's not something that in general is always fun to talk about. But I would just say start having the conversations. Ask questions, and it doesn't have to be pointed questions, but just, ask questions that'll start to kind of peel back the onion on some of these things. Educate yourself. So there's a ton of resources out there. Oftentimes, too much in my opinion sometimes, but educate yourself nonetheless, right? Be a sponge. Of course, if you know someone that has, gone through some component or aspect of senior care, whether again it's providing it, or maybe someone had a spouse that needed care, I would say consult with them. Find out some of the challenges that they may be faced, and then at the end of the day, it's really work with a professional, right? You're at the end of the day ultimately going to need a team to navigate some of these challenges and navigate this area, and don't do it alone, right? Make sure you have around you that's knowledgeable, and that puts your best interests in mind. But that again is really, to me, what a couple things people can do initially to really start to go down the path of putting together a really robust senior care plan.
All right. Well, thank you so much for all your insights on senior care financial planning. I appreciate you joining the show today.
Yeah, thank you, Deb. It was great to be here. I appreciate the opportunity.
The friendship, the closeness that two people can have My caretaker just does everything I ask her to do.
Motivates me to the extent that I know that I can live another day.
She's my transportation. When we shop, groceries, she fixes my hair for me. And she makes her lunch, she makes supper, she just ordinarily is a companion. And she walks the dog, which is wonderful. And so she's a lovely companion.
I love her. She's fantastic, and she's doing a good job.
Time is valuable, especially when it comes to caring for a loved one. Instead of spending your day juggling caregiving tasks, you could actually spend quality time with your family, enjoying the memories, playing games, catching up on work, or simply relaxing and getting recharged. A client review stated, "We used First Light Services to care for my mom for almost 3 years in her home. We were very lucky to find such loving and compassionate caregivers. They were knowledgeable about mom's issues and truly cared about her well-being, as well as helping the family learn how to adapt to her changes. Our caregivers are professionally trained, background checked, must pass a drug test, and are compassionate. We offer flexible plans tailored to meet your family's needs, ensuring that you get time back in your day without compromising the quality of care. Don't let another day slip away being a caregiver. Make the call today and let First Light Home Care of Greater Lansing illuminate the pathway to exceptional home care and give you back the gift of time."
Welcome, Jane. Nice to have you on the show today.
Thanks, Deb. It's great to be here with you.
Awesome. Well, Jane is from our First Light corporate office, and I know she works a lot with education, but I'm going to have her tell us a little bit more about what she does for the First Light corporate office.
Thank you. So I'm a geriatric occupational therapist by license and training, but my passion is helping caregivers become more competent and confident in working with folks with dementia. So I get to have a special role at First Light as Director of Learning and Development.
Awesome. So let me ask you a few questions. What is the best care solution for aging loved ones? Would it be at home or in a facility, or what are your thoughts?
That's a great question, Deb. And I know many of us with older loved ones, myself included, struggle with what is the right place for our loved one? Where can we help them to maximize what remaining abilities they have and still get the care to provide safety? So, as we think about the journey of aging, I think in terms, Deb, of sort of 3 stages. The first stage, as we notice our older loved ones struggling a bit, is how do we support them enough to be independent at home? And so some of the things that we have to think about at this point is, are they taking their medication on time and as prescribed? Are they getting nutritious meals? Are they safe to drive? And if they aren't, how can we support them? And that's what I love about First Light, because we have just the trained caregiving teams to be able to support what a normal day of thriving is for a senior in their own home. That independent phase transitions to the next phase. And that's really where we see more safety concerns. So it's at this point, Deb, that we have to really consider, do we increase the amount of help that they need in the day? So for instance, are they safe walking, or do they need a companion to walk around the home or take them out? We have to think about, how do we prevent falls? How do we support judgment and decision making in their day. That's really the safety issues. And when we think about that, how can we adapt the home? More grab bars, maybe a shower bench or chair. We'll look at in terms of any throw rugs that need to come up off the floor, or extension cords that could be trip hazards. How do we increase light in the home? So we've gone from maximizing independence and then considering safety concerns. As that aging process continues, decline is expected. And that's when we have to really make some decisions. And those decisions are sort of that third phase. How can we support comfort? How can we maximize comfort for our loved ones as they're aging? How do we manage pain? Do they need more help if they're no longer able to get out of bed easily? Do they need help with transferring in and out of bed? And how much care can be provided at home? I always think personally, and I speak from having my grandmother with Alzheimer's live with us, and my mom with memory loss, seeing those stages take place like I've described. I think home is the ultimate place for folks to age, surrounded by belongings, familiarity.
Yes, I totally agree with that. Just because I see people thrive when they're at home, and they tend to decline a little quicker sometimes when they're not in their own environment. So, but how can families better plan for continued changes ahead of them?
So I think planning is the key to that. We have to anticipate that change is inevitable. The aging process includes change. So, for instance, when we think about physiologically with our body, those adaptions we already talk about might have to go a little bit more. Maybe someone's no longer able to climb the stairs to a second room bedroom. So we would perhaps put in a chairlift in the house. We have to think about, how can someone function as much as possible normally in their environment, and then what needs to be adapted to be able to ensure that. At the point, and this happens as well cognitively, we have to think about how much cueing, how many reminders, to help someone stay on task with a day and do meaningful, person-centric, we call it, engagement in what they love to do, whether it's gardening or whether it's crafts or whether it's walking in the park. We'll have to increase the amount of assistance. To plan for that final phase, where we're really looking at how do we provide the most comfort, we have to weigh out not only the number of hours it takes based on the changing needs, but as well the finances around that. So I'm not a financial planner, but I always recommend looking into what benefits are available to people as the need for more care increases. For instance, a veteran may have some unique benefits that they can use to help support them at staying at home as much as possible. But in addition to that, perhaps long-term care insurance. I have a dear friend who's 96 and still living at home with the help of a caregiver, and that is because of great planning with long-term care insurance. What we don't want to do is wait till a trauma occurs. That's not the good time to begin to plan. And what I mean by that is a fall may occur, a change of condition, something sudden and acute, whether it's an infection, whether it's an injury, whether it's a heart attack, all of those things can happen, right, during the aging process. And we want to have in our minds what the plan is going to be as a family coming together and actually writing out, here's the choices that mom or dad, grandma and grandpa really have decided. So maybe visiting a facility or maybe a day center that could help support meaningful engagement, interviewing home care companies, knowing who we're going to call when that plan has to be put into place.
That's a good idea. Too many people do wait till the last minute, and then they make decisions that, are too quick, and they don't look at all their options. In fact, they probably don't even know all their options.
Well,
So,
I think you're right. A dear friend of mine just got a call that her father fell. She's on her way down to Florida because he had to have immediate surgery, and now all the decisions have to be made at this point. That's very stressful for a family where if we've already thought through what happens if A, what happens if B, what happens if C, we can have plans for each of those contingencies, at least thought through, not in the trauma of the stress at the moment.
right. So what is the, what is the number one need for care?
Well, I've already alluded to it. Our number one need in our country is cognitive decline, memory loss caused by dementia. Now, many people may think dementia is the same as Alzheimer's. So let me just clarify a little bit there. When we talk about dementia, we talk about sort of an umbrella term, a term that indicates a group of symptoms. So we talk about what we've already said, memory loss, but that memory loss causes a change in our ability to function normally. We might see medications being missed. We might see meals being skipped. We might see hygiene decline. All of those are symptomatic of changes in the brain we call dementia. But there are over 110 different causes of types of dementia. So among those 110 plus are Alzheimer's, which accounts for about 60%. But there's also frontal temporal dementia, vascular dementia, Lewy body dementia, you might have heard in the news recently. And then there's many, many more beyond that. And we're uncovering some of the causes of different changes in the brain, these symptoms called dementia. That's the number one need, that people are not able to stay in a safe routine without guidance and cueing. That is what we label companion care, someone to come alongside them, some to help give verbal reminders or initiate a sequence in terms of grooming, hygiene, brushing teeth, getting dressed, someone there to oversee that they are safer and as well thriving in the home environment.
So how do you know for sure that caregivers are trained well in dementia care?
And I would ask that question of anyone you're beginning to hire. So it's very, very important that not just a baseline knowledge. In fact, I got some feedback this past week from a caregiver who said, so many trainings in dementia just talk about what dementia is, but they don't equip caregivers to understand how that applies to success during a day. And so at First Light, I had the privilege of creating our own compassionate memory care training. And it's a very comprehensive training involving starting with getting to know what a person values. Are they a morning riser? Do they like to sleep in? What's their favorite breakfast? When do they get dressed? Is it first thing? Is it after breakfast? So learning meaningful routines is where we start at First Light. And then we begin to with our caregivers trained, know just the right amount of assistance. We don't want to do for people if they're able to be somewhat independent. Maybe they just need a reminder. We don't want to take away people's dignity and independence if they can accomplish tasks in a day. So our caregivers at First Light, who have been trained through the Compassionate Memory Care program, our own program, know how to understand the changes in our caring that we provide for people at different stages of dementia as the disease progresses. Not too much, not too little. Mm-hmm. And then what we look at is thinking about what someone is most proud of in their life and how can we surround a day or a week talking about, communicating about, looking at photo albums, reminding them of these special times in their life. We call that reminiscing from an occupational therapy perspective, but our caregivers with compassionate memory care know how to do this so that we're able to succeed in our mission. The best day every day for not only the client, but their family's peace of mind, and the caregivers just have joy in being able to provide that just right care based on remaining abilities in each stage of dementia. So we focus not on what people have lost, we focus on what they still can do. And we love creating days of joy with them.
Yes. I'm in the process of doing that training myself. So our caregivers will all be trained very, very soon. So, well, thank you so much for joining us on our show today. I really appreciate all the information you provided. And thanks again. Have a great day.
It's my pleasure. Thanks, Deb.
The friendship, the closeness that two people can have.
My caretaker, it just does everything I ask her to do.
Motivates me to the extent that I know that I can live another day.
She's my transportation. When we shop, groceries, she fixes my hair for me. And she makes her lunch, she makes supper, she just ordinarily is a companion. And she walks the dog, which is wonderful. And so she's a lovely companion.
I love her. She's fantastic, and she's doing a good job.
Time is valuable, especially when it comes to caring for a loved one. Instead of spending your day juggling caregiving tasks, you could actually spend quality time with your family, enjoying the memories, playing games, catching up on work, or simply relaxing and getting recharged. A client review stated, "We used First Light Services to care for my mom for almost 3 years in her home. We were very lucky to find such loving and compassionate caregivers. They were knowledgeable about mom's issues and truly cared about her well-being, as well as helping the family learn how to adapt to her changes. Our caregivers are professionally trained, background checked, must pass a drug test, and are compassionate. We offer flexible plans tailored to meet your family's needs, ensuring that you get time back in your day without compromising the quality of care. Don't let another day slip away being a caregiver. Make the call today and let First Light Home Care of Greater Lansing illuminate the pathway to exceptional home care and give you back the gift of time."
Welcome back to our final episode of Senior Care Insights. Sorry about that. They can cut it. Welcome back to our final episode of this season only of Senior Care Insights. Our final guest is Brett Lomicky, and he works for FOX Rehab. So, Brett, tell us a little bit about yourself.
Yeah. Well, first off, thank you, Deb, for having me and having FOX Rehab be a part of this here today. Really excited just to speak with you and share some insights from my perspective on the senior living industry. Just a quick background on FOX Rehab itself. We just celebrated our 25th year anniversary this past year in 2023 of providing geriatric house calls to the older adult population. Began on the East Coast in a town called Cherry Hill, New Jersey. And we're actually just celebrating getting into our 30th state now this year in 2024. Just really spreading the good word about what FOX is able to do and provide.
All right. So what's the company's mission?
Yeah, so it was founded. Our founder, Dr. Tim Fox, was a physical therapist in New Jersey himself. And what he found was this mission that he really believed in was defeating ageism, defeating the idea that older adults are no longer able to make improvements. People of older age can't make functional improvements as they age. And so, he challenged that notion back in 1998 when he started the company, and really have grown that idea now, by showing that people of all ages, kids, adults, older adults themselves, everybody can make functional improvement. Everybody can benefit themselves if they get the right care that's brought to them in a setting where they're able to, thrive, where they're able to really get the time and dedication from someone that can give them that ability, whether it's getting back up on your feet again, getting back out into the community, doing hobbies, restoring aspects of your life that maybe you haven't done or participated in a while. And so that's, that really is what drives me, is this growing older adult population we have in this country, in this world, and noticing that they've often been underserved at times. So it's giving them, the same access to resources. In the case of FOX Rehab, giving them the same access to therapy within their home setting that's really going to allow them, to make those benefits to improve just like anyone else would be able to.
Okay, so what are some of the services specifically that FOX provides?
Yeah, so we call ourselves an outpatient on wheels practice. It is an in-home, experience where all of our clinicians, we have physical therapists, occupational therapists, and speech language pathologists. And, their passion is to really bring that care to the home setting, wherever home might be. Whether that's, someone living on their own, aging in place in their home, living with a family members in their home, or living in a senior living type setting, wherever that home setting is for them, that's our goal, is to meet them at that place, to allow them to get the convenience of those services in the home. And so, it's a combination now where I think we're seeing people looking for these resources now more than ever. And I think in some ways we think about COVID and how COVID demanded us, to work differently and think differently. And so I've seen now more and more resources and companies that are reaching out to older adults, bringing those services to the home. And so, that's been FOX's mission all along, is to continue to do this. And we split that pretty evenly between the senior living, type communities that exist in this country, whether it be an assisted living, a memory care, and independent living. I think we're seeing more and more of these 55 and over or 65 and over type communities, these active adult day type communities where, older adults are still out and about engaging in these communities and looking for resources, that can provide them that care and keep them safe and independent, where that home setting might be. So that's really Fox's model is built on what we call these geriatric house calls. And I think we're seeing more of a need for it now today in 2024 than we ever have, which is part of what makes this so exciting.
Okay. So how is Fox adapting to the change of the ever-growing, the elderly population just continues to grow and grow. And I mean, I think that's great because people are living longer and people are staying healthy a little bit longer in some cases now. But so how are you adapting to that?
Yeah, hiring more clinicians, finding more people that have a passion and a drive to really help older adults. I think, you just mentioned it, Deb, but we have an aging population. We talk a lot about our baby boomer population and how they're now getting close to that point where they need to look for options for themselves, or they need to seek, proactive ways to stay independent, to stay safe in their home. And you compound that with people are living longer. People are living later into their life really than we ever have been. So you take both of those right there. You have an aging population of this baby boomer generation paired with, medicine and the medical industry allowing us to live longer and to live healthier lives later into our life. And so, I speak to the need. The need is greater than ever, I think, for similar minded people like us to give these resources to older adults, to educate them on what their options are. Because that's something I find more than anything is much of what I do is just educating. It's letting families know, it's letting the older adults themselves know that there's options, there are resources for you wherever your home setting might be to keep you safe there, to keep you properly aging in place there. And so that's part of what drives me is just having that conversation with the family, letting them know that there's going to be options for their loved one, for their mom or their dad to continue to live in that home setting. We speak to so many families where they've been in the same home, say, for 50 or 60 years, and they never want to have to change that reality. They want to find ways to continue to keep that home setting that they have. So, for us at Fox, it's continuing to find clinicians. It's finding therapists that really have a passion for helping the older adult population. And I think that's, a big piece to continuing to keep that forward thinking, to continue to find people that truly love and have a passion for serving.
So how do you view in-home care and how does Fox play a role in that?
Yeah, I like I mentioned, the pandemic, I think it made us all think about things a little bit differently. And so I think because of that pandemic, people weren't going out and about, they weren't traveling to clinics or different types of settings for social reasons. And so we had to transform as a society, really adapt. How can we be different? How can we change and still reach people in their home that way? And so, Fox has played a role in this, like I said, now for over 25 years in bringing that in-home care, in-home therapy to older adults. But now it's more important than ever, because of this growing population. We have to continue to be creative in finding ways to reach them, finding resources that can keep them independent. And, whether it's therapy, caregiving services, there's a multitude of ways to get people these in-home resources. But, now I'm seeing newer and creative ways to keep people safe in their home. And so With the use of cell phones, there's been a new drive for something called remote therapeutic monitoring. And so now that a lot of older adults also have cell phones with them at their disposal, it gives other people the ability to track things that are going on in the home through the use of a phone or through the use of some technology to really monitor what is going on during the day. Say there is an older adult that lives by himself or herself at their own home, and maybe families questioning or providers are questioning whether they're safe or not. Through the use of some of this remote therapeutic monitoring, we can actually start to see things going on. It's going to measure their gait, their ability to get up and down in their house, their ability to safely transfer in and out of bed or in and out of the shower. And so I think, we talk a lot about the importance of people, the importance of having therapists and caregivers to be able to provide these services. But for me, it's cool to see now how the industry is evolving a little bit and how some of these resources now through technology are really allowing us to get a better understanding or to have more data on what is happening in the home beyond just having a therapist or a caregiver be there. We can use some of this cool technology to our advantage and as a second set of eyes in some ways to make sure that they are safe. They are going to be independent. They are going to be able to care for themselves in that way. So, a long-winded way of saying, we continue to adapt to be able to find them resources in their home. And so I think through the use of technology now, there's becoming newer and innovative ways to really do that and accomplish that.
Okay. Yeah, definitely. The technology is mind-boggling at times. There's so much going on that we probably won't even realize, like in a year, what's going to be new. So,
yeah.
So what are the differences between providing care in a senior living community versus providing some care for someone living in their own home?
Yeah, the structuring is different, right? When you're working in a community setting, whether it's any level of care, it could be a skilled nursing or an independent living or an assisted or a memory care, there's that on-site staff, right? There's an executive director or a director of nursing oftentimes that really oversee the management of that community. But then with that nursing component, they're also overseeing the care of those residents that live there. Really an extra set of eyes to manage them, make sure they're safe. Versus the in-home setting, not those same level of resources, right? You're relying on family members. You're relying on maybe your physicians or your providers. And so I think in the in-home setting, because, everybody wants to stay at their house, we want to live in our home and age in place as long as we can. We look to our doctors, we look to our providers, our nurse practitioners to really be, a resource and advocate for what that older adult needs in the home in order to keep them safe and to keep them independent. And so I think, within the home, that older adult really has to find these resources more in order to keep them safe. There really becomes an importance on them seeking the resources that they need versus you go to a community setting, a lot of those resources are given to you then. A lot of the nursing or assistance that you might need on that day-to-day basis, that's going to be provided to you. It's, part of that burden is taken off of you. So I think, with people, of course, wanting to live in their home and age in place in their home, it becomes really important, to advocate for yourself, to look for the resources like ourselves that are out there to help you do that successfully. And, we preach oftentimes in senior living and especially at Fox, we preach be proactive, right? Think about these things before they become mandatory, before a crisis type situation presents. It's looking for the resources ahead of time and starting to implement them even oftentimes before you even may believe you fully need them. Because what that's going to allow you to do is, if not just maintain, even improve, your ability in the home, your ability to stay independent, because ultimately that's what's going to keep you there. And so, I think the mindset we often see is somebody maybe has a fall in their home or they are showing decline. And then it's not until a major event happens, say a hospitalization or, a more traumatic fall happens, where now that we're in a crisis situation, now we're running to find resources and to find ways to cope with what's happened. And so that's what I preach is be proactive. If you're someone that's looking to age in place in your home for years and years to come, find these resources now. If you're in what you believe to be a good situation right now, you of course want to keep it that way. So find the resources out there now ahead of time that can allow you to stay in that good independent state that you're in. And then, allow you, of course, to continue to live in your home for as long as you can.
Mm-hmm. Yeah, I've seen many people wait too long to get any kind of help because they just want to stay independent, but really prolonging that help is making them less independent. So it makes sense to get the rehab needed to build strength, and to potentially have home care to make sure that you're getting the proper meals and you're having someone walk with you or, do things with that person just to keep them home a lot longer.
And I just think about, some of the most fundamental aspects of providing an older adult in-home care is just the companionship. It's just that social component, right?
Right.
Gosh, you think about the psychological impact of aging, the scariness to maybe living on your own in a home as you're aging yourself, and just to have somebody, to look forward to be there for you, to support you, that goes a long, long way. And, I think with a lot of the isolation that's occurred, in recent years, that's needed now more than ever. That need to have that friend, that caregiver, that therapist that's coming to see you throughout the week. It's something to look forward to. It's something positive for them that can really change their psychological outlook. And when they have that friend, that social support, that companionship, they're going to be more motivated then to do things, to make improvements, to work hard in therapy, and in turn to stay independent. So, it's very important.
Definitely. Well, thank you so much for joining us on the show today. I totally appreciate you sharing some information about FOX Rehab and how it can help our seniors stay independent in their own homes.
Absolutely. Yeah. Thank you, Deb. Privileged to be here. And thank you for having me today.
The friendship, the closeness that two people can have.
My caretaker just does everything I ask her to do.
Motivates me to the extent that I know that I can live another day.
She's my transportation. When we shop, groceries, she fixes my hair for me. And she makes her lunch, she makes supper, she just ordinarily is a companion. And she walks the dog, which is wonderful. And so she's a lovely companion.
I love her. She's fantastic, and she's doing a good job.
Time is valuable, especially when it comes to caring for a loved one. Instead of spending your day juggling caregiving tasks, you could actually spend quality time with your family, enjoying the memories, playing games, catching up on work, or simply relaxing and getting recharged. A client review stated, "We used First Light Services to care for my mom for almost 3 years in her home. We were very lucky to find such loving and compassionate caregivers. They were knowledgeable about mom's issues and truly cared about her well-being, as well as helping the family learn how to adapt to her changes. Our caregivers are professionally trained, background checked, must pass a drug test, and are compassionate. We offer flexible plans tailored to meet your family's needs, ensuring that you get time back in your day without compromising the quality of care. Don't let another day slip away being a caregiver. Make the call today and let First Light Home Care of Greater Lansing illuminate the pathway to exceptional home care and give you back the gift of time."
I want to thank our guests today, Christian Whitehead, Jane Yousey, and Brett Lomicky, for joining us and sharing some excellent information about senior care once again. This is our final episode for the season, but don't worry, we'll be back in the fall. We're taking a little bit of a break and planning a much better season. Even though we've had a great season, we're planning another great season for next year. In the meantime, this is Dr. Deborah Moerland saying good night.